authorizing a funded, subsidized civilian cyber health corps. That's us, David. We're going to be in that. We get a uniform and everything.
Do I get a badge?
Yeah. I get a hat and a badge. Yeah, we could be leaders, David. We could be leaders.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to episode 413 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle of Garden. Good afternoon, Donna.
Good afternoon, David.
How's your June going?
It's almost over, isn't it?
I know. I'm still kind of shocked that the weather's as mild as it is.
I know. It's the weirdest thing, and there's been a lot of conversations about it recently with all friends and family as we're sitting outside, and it's like we're comfortable.
I know.
In June, at the end of June.
I know. I was out yesterday. It's like low humidity and high 80s, and I'm like, this is weird.
Where do I live? Did I move?
Yeah.
Did I move?
But there's not even a lot of bugs out.
I know, right? Even the bugs are like, nah, this is not right.
Yeah, something's wrong. So cool. So speaking of not right, though, we're going to be talking about some stuff today that's going to make us wonder where are we going to go from here.
Yeah. There's so many things that make me wonder that.
Yeah, and I can't wait to get to the HIPAA Say What segment. I have so many questions.
I do too. It's just not clear. It's just not clear.
So before we dive into that, though, I do want to thank all of our 20 million listeners. Hit a new milestone.
You're so wrong.
Thanks for those who help keep us on the air. Without you, we would be two dumbos talking in a microphone.
Well, we still are that, but at least people are listening.
I know.
Oh, and I have to shout out to our friend George. Thanks for worrying about me. And David, I haven't even told you I got a special care kit because I had been ill.
Well, if that's what it takes, I don't want one.
I know, really.
If I have to get COVID to get something from George, then I don't want one.
Well, I appreciate it, George. I got to send you a picture. I keep forgetting. Maybe I'll remember now. It'll make sense to you when you see it. But anyway, thank you again to all who reach out, but especially those who send us presents.
Yeah, especially those.
I like the ones that send me presents and not David.
Oh, I know you do. You tell me about every single one of them.
Well, when I get them and then I got to get them to you, I'm not investing in shipping them.
I know. It's like, I'll see you in about 6 months. I'll give it to you. Yeah.
If you want this, I'll send it to you. If you want this, I'll send it to you.
Yeah.
That's how we roll.
Indeed. It is how we roll.
All right. Let's do this.
Yeah, man. So I want to jump right into this HIPAA Say What, because this is definitely worthy of that phrase.
So what?
So last week, looking at my email, and a resolution agreement pops in, and I'm always excited when I see them. But I read it, and it was like, snooping in medical records by hospital security guards leads to $240,000 HIPAA settlement. And I'm like, security guards? Snooping?
What?
What? How does security guards have access to PHI to be snooping?
Yeah. Why would that even be an option for them?
But then when I kept reading further, it's even more like, what?
Again, what?
So let's talk about this a little bit. And, for all of you people who have security guards, you might want to listen to this.
Well, there's a lot that, anyway.
Yeah.
Yeah. So this is Yakima Yakima. I don't know. It's in Washington State, where I pronounce everything incorrectly about the towns there. I keep learning all the Western things that we think we know how to pronounce are wrong. So, whatever the pronunciation is, it is the hospital, Yakima Valley Memorial Hospital. And I mean, this one, again, this just shows these long-term ones that this goes back to May 2018 when they conducted an investigation following the receipt of a breach report dated February 2018. So I'm just saying, you know, the important thing that we need to point out here is that this did not involve more than 500.
Mm-hmm. Yep.
It did not involve more than 500 patients, yet it came from a breach report made in February, which is the end of February is when you have to report for the previous year. I'm just saying. Anything less than 500. Interestingly enough, that's when this was made. And 419 individuals.
Yeah.
Conveniently less than 500.
Yeah. But, so, my first question to myself was, how did a security guard, this is my first question, and
a single one.
Yeah. How did a security guard have time to access 419 individuals? But then as I read up further, I realized it wasn't one security guard or even two.
Oh.
Or even 10.
It is all of them, apparently.
23 security guards. 23.
Mm-hmm.
I'm like, okay. It's a culture.
You're right. That's what it is. It's a cultural situation.
Yeah.
Wow.
So
that's an interesting way to put it.
And I can imagine, like, every one of these 23, I can imagine this is the thing you do on night shift from 3 a.m. to 6 a.m. when nothing's happening. You're like, dude, we walked around this building 100 times checking windows and doors. Let's log into some patient records and see who we can find.
No, I mean, what? I mean, it's snooping. So, what? I got nothing. I mean, they don't offer a lot of details, but we do have the, the press release official statement that should tell us something, but it doesn't really tell us anything new where we're like, what had happened was.
Mm-hmm.
So you want to read our official, what we're supposed to learn from this?
Yeah. So from the director, the OCR director, and she says, data breaches caused by current and former workforce members, which makes me scratch my head there.
Well, no, it's when they don't, turn people, they don't deactivate them when they leave. So some of these could have been had already left.
That's what I'm wondering. Like, why did you mention former workforce members?
Yeah.
So, okay. So data breaches caused by current and former workforce members impermissibly accessing patient records are a recurring issue across the healthcare industry. Healthcare organizations must ensure that workforce members can only access the patient information needed to do their jobs, which was definitely one of my questions.
Yeah.
HIPAA-covered entities must have robust policies and procedures in place to ensure patient health information is protected from identity theft and fraud.
Gotta wonder what they were doing.
I know. Why does your login... First of all, I don't understand why you have one, but why does your login give you access to see this stuff?
Mm-hmm. Because they worked in the emergency department and used their own login credentials. So it's not like they stole anybody. They didn't hack anything.
Yeah.
It's what they did. So, yeah, I got a lot of questions. Now, there might be an article somewhere that explains it in depth. I hadn't had time to look it up. This one just came out. and we're going with it, and maybe we'll get more details, but the bottom line is, why?
Yeah.
Why?
Was it hospital security, or was it like a third-party vendor hired out security?
Well, and, there's some of the things that they mention in the corrective action plan, because, yes, they agreed to pay the money. Was it? Yeah, $240,000, not millions, but $240,000. Still not something we stroke a check for in our world. And I doubt in an area like this, probably not. Something that they take lightly, being able to do that. But then, they will be monitored for 2 years. And I have noticed, we keep, all these years we keep saying what you want to do is pay attention to the cap. All they do is talk about the money, and then nobody's paying attention to what that truly means and what they're committed to doing in the corrective action plan, which is what we've always kind of focused on. And in the last few of these announcements with the corrective action plans, like this one, they actually say specifically that they will be monitored for 2 years. They don't just say corrective action plan. They'll be monitored for 2 years by OCR to ensure compliance with the HIPAA security rule. They have agreed to take the following steps, and this is something I bolded in my notes, to bring their organization into compliance. Saying, we know you're not compliant, and you're agreeing to clean up your act.
Mm-hmm.
But then we know what the things are. And, these are the same things. These are the things that are the same things that you need to develop a program.
Yep.
You don't even have to look. Well, I mean, they do phrase it slightly different each time.
they get tired of saying the same things over and over again. Like, eventually we'll find the phrase that actually sticks.
Mm-hmm. So, risk analysis, risk management plan, develop, maintain, and revise as necessary written policies and procedures. So, develop, maintain, and revise. And I just had a conversation with somebody about, you develop them, but that doesn't mean you're done.
Yeah. It should say develop, maintain, revise, and follow.
Implement. There you go. It doesn't say implement. That's what it doesn't say.
That's not good.
Yeah. Develop, implement, maintain, and revise. You got to do all of those.
Yeah.
And then I love this. Enhance its existing HIPAA and security training program to provide workforce training on the updated HIPAA policies and procedures.
Yeah, and we don't often see where they talk about something that's existing, so that's nice.
Well, because they've had the classic basic HIPAA training that didn't actually include their own policies and procedures.
Mm-hmm. Yeah, well, we see
it
that.
didn't actually discuss this is what you're supposed to do.
But I watched a 30-minute video. I'd love the guy that one time told me, and I thought he was joking because I laughed at him, and then I felt bad for laughing at him. But he told me how he had HIPAA training for 18 years or something like that. And I was like, that's fantastic. And he's like, yeah, we went through the same, 1 hour video training every year. I know HIPAA. I was like, dude, I'm going to do more training in a week than you've done in a decade.
You could add that full 18 hours of the same repetitive stuff and not get any of the things that have changed.
As I like to say, you've only got 1 hour's worth of training. You just did it 18 times.
Mm-hmm. Jeez. So yeah, you got to train the people on what it is that they're actually supposed to do, and your policies and procedures should be customized to your operation, not just cookie cutter. And then we get to the part where it might be the question being, were they contractors, business associates, what? So review all relationships with vendors and third-party service providers to identify business associates.
Yeah.
And we say this a lot.
Yeah, because if you would,
Well, I can show you who my business associates are. Okay, but I want to see all your vendors.
and if you would have come to me and said, we've got this contracted security firm, are they a business associate? My initial answer to you probably would have been no, because in my mind, they have no reason to be in these systems at all.
See, but I have been taken down too many rabbit holes. I say, what will they be doing in their job, and will they have access beyond incidental?
Mm-hmm.
I don't care what their job is. I've found too many people having access to stuff because it was convenient at somebody's juncture. So they just gave them access, unfettered access to everything.
Yeah.
Because one time they needed to see one thing.
Mm-hmm.
Yeah. So anyway, they have to review all your vendors and third-party service providers, which is what we always stress. Every vendor should be evaluated. Period. And if you do not have a business associate agreement, you find that you do not, once you get one, post haste. Yeah, don't wait around. Get it. I was just doing some consulting, and somebody said they couldn't find the business associate agreement, and I said, have you sent one yet? We're sending it today. Very good answer. Very good answer. Don't wait. So the big picture here is, what?
Mm-hmm.
Why? Wow. And yeah. That's what HIPAA say what to.
Yeah, and it wasn't even like, Los Angeles or something like that.
No. It's, a lot of stuff, they're just bored.
Yeah, I believe that's what a lot of it was. Well, we ain't got nothing else to do. Let's see who's got chlamydia this week. I don't know, man. I don't.
Yeah, and they read some of the notes on that are in there that are private, and anyway, snooping is bad.
Yeah, I can hear him now. Hey, Scott, you remember Mary from high school? Check this out.
Yeah, I see you doing that. I do.
Not me.
Yeah. No, no, not you. I would never expect that of you. But yes, I see them doing that. These snoopers that they had gathered around and talked about it.
Yeah.
Because it's not that the culture wouldn't be there so widespread if there wasn't frequent discussions about what they'd see.
Yeah. Well, there's probably somebody who's more technically inclined than the others.
Mm-hmm.
He figured it out. Oh, check this out. Look what our login gives us access to. He showed one guy who showed two guys who showed five guys, and then 20.
And then we got burgers and fries.
Yeah.
And
23 people later, we have a problem.
We don't know what all of a mess we got.
23 and me.
We're going to start doing advertising. We got to get money.
I know.
Time to move on. But people, educate. And the fact that, they're a hospital that's been around forever, I'm sure they're, locked down, is absolutely wrong. Too many people assume that just because you've been in healthcare for a long time, you know this. Like 18 years of... I can't even get it out. Anyway, let's move on.
Where do you want to go from here?
That's a good question. Well, this came out when I was doing my vacation /COVID /tooth extraction back to back to back. And I missed it. And then it came up in one of our discussions, our all hands meeting. And then I'm like, well, I'll be LIB, MR pigs.
MR ducks.
So the health industry, cybersecurity, the public sector, critical infrastructure, resilience, partnership, blah, the big thing that we're part of in a tiny little way, released a document that is the official language is the Health Industry Cybersecurity Recommendations for Government Policy and Programs, April 2023. And ironically, it came out on the 25th, the day that I went, I don't feel good. Anyhow, there's some interesting stuff in here. And then on top of that, I saw this article about a hospital in, where is it? Illinois, or Illinois, if you haven't ever been there, that is, and I think it's fairly rural area too. Yeah, Spring Valley closed this past Friday, or the 16th of June, 2023. And they're the first hospital that has specifically said, due to this cyber attack, this ransomware attack, we're closing. Now, there's been 2 different doctors' offices that have. One in California, one in Michigan. So they're not the first provider, but they're the first hospital level that we know of that has specifically said, here is why this happened. But it was kind of like the cherry on top in the statement. The chair of the hospital said last month that they were going to close, quote, due to a number of factors such as the COVID-19 pandemic, which I told you, we know how that has seriously impacted the healthcare environment in so many ways. But then the cyber attack on the computer system of St. Margaret's Health, which they're a part of, and a shortage of staff, it has become impossible to sustain our ministry. So they threw that cyber attack in the middle of it, and the ransomware attacks hit them, and I think they said that it was days, like months, before they were able to do billing again. And this is one of the things that we point out to people who think, well, all I need to, in my incident response plan, is a couple of hours. Nay. No. The same group had another hospital in a nearby town that closed in January. So you've got not only the hospital's not available, but guess what? All of the providers in the area, all of the business associates that provided services, all of the healthcare providers who work there, and all of the other elements that you have, like, I don't know, security guards, it's all gone. There's no emergency room. There's no place to have the babies. I mean, you got to go a lot further, and I don't know how many, but this was a ransomware attack from 2021. So that kept them from being able to bring in money for months from Medicare or Medicaid. And of course, if they ain't no bills going out, there ain't no checks coming in. So with news like that, and that, we already hear how they're struggling to survive, the small ones, the rural ones. And we read that, we reviewed a few weeks ago the hospital landscape report, and it specifically touched on the problems for the smaller entities. This thing happening impacts everybody, the patients, the care providers, everything. And we also learned that even if they survive an attack, the other institutions nearby We learned it with the allergy clinic in Oklahoma City. We learned it with the study in the landscape and some other studies that specifically pointed out that any attack in an area will impact those around it, because that overflow's got to go somewhere.
Yep.
So with that being said, we all know all of this. Here was the bullets in this. First of all, we need to touch on what this, some notes into their intro of why this is here. And it's talking about the right up front, cyber threats to healthcare sector are well-documented reality of modern healthcare delivery. Boom. It's right there. And so it goes into the complexities of the ecosystem, which we've also talked about repeatedly. It is, there's I like how it says, what is it? Unknown inherited security weaknesses.
Mm-hmm.
Over-reliance on vendor solutions.
Yeah.
Systems that fail to adequately account for human factors. And inconsistencies between software and equipment life cycles. Those are life cycles. Equipment does not have lifestyle.
Not yet.
It's AI. Which, by the way, is not a featured element of any of these recommendations for all the people that are worried about AI. But it does point out we are adopting new technologies faster than we are updating security practices. Yes, we know.
Mm-hmm.
Therefore, creating a growing gap between slowly developing security posture and rapidly evolving security threats.
Yep. That one sentence says it all.
I know, right? Preach it!
Mm-hmm.
I mean, that is a big point in the whole thing. Just starting with that is why that's where we are today.
Yeah.
And I like the other point was ensuring that a hospital or clinician's office is, quote, cyber secure alone is no longer sufficient. Modern care delivery requires that all disparate pieces of the evolving healthcare ecosystem be considered and appropriately secured as well.
Yeah.
Yes.
That whole paragraph scares me to death because we're still having conversations with people about, use better passwords. Don't use free antivirus. I mean, we're still doing the ABCs of cybersecurity. And yet
we still can't say that we ensure that a clinician's office is cyber secure. Just the basic.
Right. Like we haven't gotten there yet. And they're already saying that's not even good enough anymore.
But we already say that.
It's not sufficient. I'm like, but I can't even get them to that.
Yeah. And that's you're right. That's the part that's super hard for us is we can't get them to do the minimums that are already in place, and those minimums are no longer good enough.
Right. And we have that exact conversation frequently with other people as well that are trying to create these things like the 405D materials and such. We often have these conversations about we'd love for them to be doing the things that are quote unquote sufficient, but we can't get the things that are lesser than that done yet because they're moving so slowly.
Yeah, you can't jump from we still argue about passwords being shared and whether or not that's okay. That's where you are. And we got to worry about actually securing the devices and all these other things that no one's even worried about because we're still arguing over whether or not everybody should know everybody's password.
Yeah. I mean, there's almost not a week goes by that I don't see some news story that starts with hackers have discovered a new way to fill in the blank. And it's like, wow.
Yeah, you're right. So if we can't get, a consistent where I can't say that I felt ever comfortable that I could walk into any practice that I haven't been working with for years and believe that they have invested time and effort in making sure it's secured. They may have, but the smaller the practice, the less likely. But not always. Sometimes it can be a nice size, several physicians, and oh, we got this is the attitude, even when they don't.
Yeah. Well, the ones I really love are the ones that say that they'll hire a provider, being like an IT provider or some sort. They'll keep looking for one until they finally find somebody who tells them, "Don't worry about that.
Yeah,
we got that covered for you."
Yeah.
Because when people like you and me come in there and we start talking about all the risks that are there and all the things they need to be doing, they're like, "I don't want to hear that. Let me go find somebody else who doesn't care about it quite as much as you do."
Yeah. I'll keep calling until I get the answer I want.
Exactly. Well, that doesn't change the threat landscape just because you can stick your nose in the sand.
Well, and it gets back to compliance is not secure. You've got to stop worrying about compliance being the thing. It's irrelevant.
Oh, yeah.
It is yet another risk that you have to manage. But we need to manage all the risks.
Mm-hmm.
Compliance being one of them that privacy and security bring to the table. And this is something we say over and over and over in all of our training. And, I even now bring that into the conversation in workforce training.
Mm-hmm.
And they're like, wait, what?
Yeah.
Let's talk about patient care and patient safety, because that's the element that everyone skips.
Yeah. I mean, compliance can be nothing more than a false sense of security.
Yeah. Yeah. And that's why when everybody's like, well, I'm compliant.
Yeah.
I don't care if you're compliant if you just lost all my data.
Yeah. At what point did you become not compliant when that happened?
You can't be fully compliant and assume that nothing's ever going to happen. Those two don't go together either.
No.
So, that being said, this was another good one that you have to have the front end to get to the tail end, which really brings it home. This imperative is addressed through both cybersecurity regulation and policy and voluntary practices implemented across the healthcare ecosystem. It is clear that given the increasing number and techniques of cyber incidents inflicted on the health system, and here's the part, neither voluntary practices nor government policy have been sufficient to reduce cyber risk and incidents across the sector.
Which leads us to the question, where do we go from here?
There you go.
That's a very fancy way of saying what we've been doing ain't working.
Mm-hmm. Yeah. And I mean, but continuing to do, what is that?
Continue to do what you've always done. You'll get what you always got.
Right. And it's kind of like what was Robin Williams would always say in the dictionary under redundant, it says see redundant.
Yeah.
It's the same kind of loop.
Yep.
You're not getting anything different, but you're saying the same things over and over and over.
Mm-hmm.
So neither voluntary practices nor government policy have been sufficient. So we know this. So that's part of my issue as we move through this, is because the whole title of the whole thing is Recommendations for Government Policy and Programs. Anyway, so the working group assesses that enhanced governmental programs and policy could offset the cost of existing cybersecurity regulatory requirements with a coordinated and coherent approach to the reduction of cybersecurity risk.
Say it ain't so.
We're talking about risk, not compliance.
Mm-hmm.
Talking about cash backing. I do like that one. Anyway, particular attention should be paid to smaller health institutions that remain vulnerable targets but do not have the resources or expertise to comply with existing or proposed cybersecurity regulations or to implement voluntary practices to shore up their cyber defenses because of, we just talked about this, increasing financial, workforce, and compliance costs associated with clinical priorities.
Yeah. So what are they going to do? They're going to give me some financial incentives to do these things?
Well, those are some of the suggestions.
Okay. How do I sign up?
In this document, they say we are focusing on the what more than the how because everybody worries about the how. But if we don't decide what the what is, then what the what? I can't figure out how to do something if I don't know where I'm going. So where do we go?
Mm-hmm.
And they're saying, look, we want to stimulate discussion and creativity within the government and with industry around possible initiatives the government can develop. Because we're just too broad. There's no way, PCI DSS, that's the credit card industry. They could do that.
Mm-hmm.
They did it themselves because they were losing money. That's it. But we don't have that in the healthcare industry. So they bring up a lot of stuff and they talk about this. Some of these things could be done under existing or new statutory authorities. But the point is help reduce risk across the sector through incentive or grant-based financial assistance, operational support, particularly to undersourced health systems, including small practice, critical access, safety net, and rural emergency hospitals. So all of that discussion about, I'm worried about the single doctor, I'm worried about the smaller practices. We get that, and that is in here. So even though so many people are like, everything's just about the health system, and neither of us ever claimed to be experts in dealing at the health system level, there are plenty of people doing that.
Mm-hmm.
That's where all the money is. That's why we so poor.
Maybe they have like a meaningful cyber use program.
Well, they've grouped these suggestions, these recommendations into 5 categories, and I grabbed a few of them. It's a very good read. Of course, we have the links to all of this. Go read it for yourself. Bring to the table some ideas because we need that. So the 5 categories. You want to run through the 5 categories and then we'll start with the first one.
Yeah. So the 5 in order are: number 1, preparedness, support, and information sharing. Number 2, financial support and incentives. I'm all ears right there.
Yeah.
Number 3, incident response and recovery. Number 4, workforce. And number 5, regulatory reform.
Yeah. I mean, it's pretty good collection.
Yeah. I'm glad they kept it to just 5.
I know, right? So I grabbed a few of the bullets, not all of them. By no means are we discussing everything that's in there. Ain't nobody got time for that. In fact, we're running out of time to discuss the things that we already have pulled out. So here are a couple of the things that they mention under. I'm just going to hit on the bullets and then we can kind of throw the discussion in on what we want to say. There's more in the blog notes. So it may be on the audio. It may be on the notes. You should catch them both. So here are the points that I plucked out of there. HHS should fund a national marketing and outreach campaign to the health provider community about the imperative of cybersecurity as a patient safety issue. And they specifically bring in the 405D and the investment in the website. And we're saying, invest more there.
Mm-hmm.
You already got it built. Let's use that for our communication, doing our outreach, but invest in it so that we have help. You and I can only do so much for free.
Yeah. I mean, honestly, I think the HHS should be sponsoring this podcast. Hello?
That's right. Ooh, there you go. We'll do that for free. Let you be. We'll do the podcast and you can sponsor it. Anyway.
Yeah. I mean,
everything gets way more complicated, doesn't it?
A la NPR. we could do it.
Funding from the blah, 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 blah foundation.
Yeah.
You have to have somebody with a calm voice do that. It certainly couldn't be us. Boost funding for HHS Health Sector Cyber Coordination Center, which is HC3.
Mm-hmm.
And we get their alerts. And it's to be the primary knowledge sharing and analysis resource within HHS to support healthcare cybersecurity in coordination with CISA. And they say specifically, Congress should make it an appropriated line item, a specific HC3 appropriated line item. Well, you know, we always say that, particularly when you look at so many people that are in financial and the other sectors, and they think they come into healthcare and they're like, well, why aren't you using all the MITRE and all the information sharing and all the other things that are available? And I'm like, you don't get it. It's not the same. Right. It's not the same because you have to take all of that and figure out how that applies across all this complicated environment that's all intertwined at a way that no other industry I know of is intertwined.
Mm-hmm.
And you never know what's going to need to touch this network because of this connectivity. And it's a constant concern of improving patient care, improving patient safety. And we're really there, but you've got to understand how complicated all this is to be able to take all that information that's coming in and then disseminate it in a way that it applies, to healthcare. We're so data rich and cyber poor. What are you going to do to a broad and deep industry? So I think that's not a bad idea, actually assigning a lead. But the next one is my favorite one. Assign an office within HHS in partnership with industry to develop a program to measure cybersecurity performance in the health provider sector. This is my fave of the whole thing is if you don't have a seat at the table, because we don't have, they have the Office of Information Security, but there's not a specific one that's dedicated to cybersecurity of the industry. It's just like anybody else. We always say, if you don't get in to talk to leadership, your priorities ain't going to get met.
Right.
You're like, I don't know about that. You're still not sure. But again, if you don't have the funding behind it and a seat at the table with proper information gathered, nothing's going to change. I do like that they have, for legislative consideration, is the Reauthorization Pandemic and All Hazard Preparedness Act, the PAPA.
Is that what it is? Yeah, it is.
PAHPA. PAPA. PAPA. It's a very interesting approach because we already know, we've talked about, these places needing help and not being prepared. And it calls for being able to activate FEMA and other services like we would in a disaster, plus funding that kind of resilience so that you have someone to turn to. Particularly the smaller ones. And it does call for funding responses that include human, technical, and financial to the victims' organizations if it's a high impact one. Where you don't know all of the people that just came in and set up all of their cases and started unpacking stuff, and they're just like blah 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 blah, like you see on like the FBI's and CSI's and all of that. Yeah, we need those people.
Yeah. Yeah, we do.
And that section has there's several sections that bring up discussions about ways to approach cybersecurity management. And it's getting so expensive, I think we're going to end up in a similar place. There's the government flood insurance program that, I don't know what we're going to do there. And it's all because so many people said, well, I don't have to worry about it. I got insurance.
Yeah.
So look where that got us. Anyway, then we go to financial support and incentives. Hello, CMS reimbursement incentives. Then we talked about this last year, I want to say.
Yeah.
Where was it? Like, if you can prove you're doing RecSec, you get better stuff.
Yeah. I mean, I think in some way that those are the types of things where you and I can have conversation with somebody and they can start seeing where it makes sense. Because when I walk in and I say things like, this is going to cost you X amount of dollars to protect you, they're looking at that from like an insurance conversation. Then it becomes, well, what is the likelihood that's going to happen? And then you kick into well, it probably won't happen to me. I probably shouldn't do it. I'd rather spend my money on a new piece of equipment that's going to bring revenue than some protections that I may or may not be able to use. Even though you and I know your protections you're actually going to be using every single day.
Every minute of every day.
There is not a time where I say, you know what, we didn't have any activity at all on this client. I mean, it's tens of thousands of times a day.
Yeah. And it literally is a choice between, where's that money going to come from?
Mm-hmm.
Because it's already been cut to pieces, which is another complexity of the healthcare system, is it's not truly a capitalist economy because too many people have a finger in the pie of setting prices. You don't just as a physician set your own price if you're going to take insurance. That doesn't happen. And I don't think people truly understand that. So I think there's a lot there, and there's a lot of flexibility there. And they do bring up funding, support, and or technical assistance for critical access, safety net, and rural emergency hospitals to remediate urgent vulnerabilities or mitigate threats. And I think that's huge as well.
Mm-hmm.
I mean, how many times do you know, well, we don't have enough people in that whole town that know how to work the computers to get an update that needs to be done quickly. And I know, well, yeah, let's go bring in Security First IT. Who's going to pay them? Because we're going to have to pay them to drop everything, which is more expensive for them too. You're going to have your people in there at all hours of the day. Don't you always love that about IT? Mm-hmm. That's another reason I don't do it anymore. Well, I want you to be available when I'm working, so if I have a problem, you can fix it, but I only want you to mess with my computer when I'm not working, so that if you have a problem, you can fix it.
Mm-hmm.
It's a dog chasing its tail. All right, where's the next one? Where are we at? Incident response and recovery.
Yeah.
Mm-hmm.
Kind of important.
When responding to an incident, timely and actionable government sharing of cyber threat and incident information is frequently inadequate for private sector needs, not just healthcare.
Mm-hmm.
And we get it. It's because they're trying to figure out, is this like an overall attack on our national security? If we start sharing how we know this, does that, endanger somebody? I mean, we don't want that to happen. If you've got an operation where, you remember where we went through, I don't remember which one of Hive, and they had gotten in there and they were secretly giving the decryption keys to the victims while they continued to monitor how things were progressing, and they could get further in to truly shut them down. So we get it.
Yeah.
But at the same time, if we don't know that's going on,
yeah,
how can we help share?
It's hard to deal with stuff like that, especially early on, because like when does the information sharing become appropriate? Yeah. Because if I'm running around with my hair on fire, the last thing I'm thinking about is sharing my information. It's like,
right.
Like, we had an incident one time where one of the kids got hurt, and you get a phone call and it's like, we need to take so-and-so to the hospital. If I say, well, why? Tell me what's going on. It doesn't matter. Just get over here, right? Like, it's not the proper time for information sharing. We're dealing with an incident response right now.
Yeah. Hair is on fire.
Right. And so I think it happens the same way when there's an incident in, a practice or a hospital. When does it become appropriate to share that information because you got to the point where things are under control enough where you can breathe enough to share information?
Yeah, and but this is talking about that there's give us something we can actually do,
Mhm.
information that we can act on. And it takes a while for them to get that. And so there's a big discussion on trying to find a way to speed it up by designating certain people, or to go in and kind of be able to figure out what can be disseminated quickly. But I mean, it's a super, super complicated discussion.
Yeah. I just don't know when you're talking about information sharing, and I'm talking in the small practices because that's where I live, but there are often times when I'm disseminating information to my client base based on something that I see or read or know what's going on. And for the most part, a lot of times it's crickets.
Yeah.
And it's not that they don't have the information, it's that they don't do anything with it.
Yeah.
Because either they don't know what to do with it or they don't have the time to do anything with it. I mean, there's a myriad of reasons, but it's not an information problem. It's a, what are you going to do with it problem.
Well, that's the actionable thing. I need to actually know. If you just say, hey, this is happening, now I got to figure out what to do. I got to figure out how it applies in my environment. I got to figure out, I ain't got time for that.
Right.
So I need to know, when we do our alerts through Cardin Club and HIPAA for MSPs, we're like, okay, you need, if there's anything that I can add to it to say, take this to your IT people and say this, I try to do it.
Yeah. Yeah, we do that. I mean, we usually have at least a couple a week where we're giving out that type of information. And there's also, here's the 3 things that you need to do because of this or whatever. So yeah, we do try to give them something actionable to go with, not just, oh, here's the information, good luck figuring it out. But just distilling it down, and we're talking about Cardin Club and HIPAA for MSPs, just distilling down the information to what you need to pay attention to is a huge thing. And it's a part of what we do because there's so much out there all the time. I mean, there's no way possible I could post everything that I wanted to post in there, because a lot of it is I wouldn't say it's irrelevant, but we have to really gauge, does this matter enough to really get their attention? Because we know we would be posting things 100 times a day if we didn't do that.
Oh, yeah. Yeah, the things we post are where we think it's important that you have access to this information.
Yeah.
And, because you and I are like sending stuff back and forth between each other constantly, and very little of that is ever something where we have time to really break that down to make it valuable to everybody else. Anyway, the next piece, workforce. Huge. There's a lot in there. And it's certainly a thing. Because they put in there, they can administer a healthcare cybersecurity workforce development and cyber training program with assistance from NIST, CISA, and the VA. Hello. People coming out of the military. Wink, wink, David's sons. You should send this to them. But they're pointing out, include access to free cybersecurity training, assistance to providers under an expanded regional extension center, which we had during the initial rollout of the meaningful use stuff, and then that just kind of disappeared. Student loan forgiveness, modeled after physician loan forgiveness programs. When we did it for physicians, let's do that for everybody. National Science Foundation Cyber Core scholarships for service. A full scholarship plus a stipend for undergraduate and master's degree in cybersecurity, and requires 2 years of government service in exchange. Okay, great. Authorizing a funded, subsidized civilian cyber health corps. That's us, David. We're going to be in that. We get a uniform and everything.
Do I get a badge?
Yeah. I get a hat and a badge. Yeah, we could be leaders, David. We could be leaders.
Yeah.
And then they were like, throw that one out.
Yeah. Just pay me a percentage of how much I saved you from not getting cyber attacked.
I know, right? But they point out this could take the form of, again, loan forgiveness, a federal program that pays or helps pay for the cyber education in exchange for a minimum number of years served, modeled after a uniformed health corps. Again, we get an outfit, David.
Yeah.
That's what I like their outfits. No, that's a uniform. That's not an outfit.
I don't know. I kind of like my uniform that I have now.
Yeah, I know, right?
Yeah.
Yeah, but at least then we would know what to wear to the meetings. But I mean, there's some other ideas in there, and they're really good. And we know we've got to get people. There's so many people that think cybersecurity is just that technical nerd thing, and there's so much that we need that has nothing to do with that.
Yeah.
I don't understand all that forensic stuff on purpose. I don't want to be caught doing the work.
That's right.
I'm sorry, stuck doing the work. But I think that's hugely important. And, but that goes across all sectors need to focus on cybersecurity and how can we bring more people into it. And the thing is, everybody's like, well, there's cybersecurity jobs open, but they're not hiring the people that are applying. And so what we have to figure out is, why aren't they? Because I see several people, on LinkedIn, and they're like, yeah, I apply, but I don't get hired. Either they want to pay an entry-level salary for somebody with, 15 years experience, which we know is a bad thing.
Mm-hmm.
You get what you pay for. And when all your profits go away due to a cyber attack, suddenly you wish you had paid a little bit of that profit into making sure you kept the rest of it. That's what I always like to say. Anyway, and then regulatory reform, and this is a huge problem in healthcare, particularly because there's so many different things that you're looking at. The complexity of the organization, again, comes into play. A holistic, coherent cyber policy strategy is essential for a healthcare environment where clinical operations, medical devices, electronic health record technology, patient data, and IT systems are all interconnected but subject to differing regulatory structures and authorities. Hear, hear.
Mm-hmm.
You got the FDA that's doing this, the FTC is doing this, then you've got the FCC involved in some of the transmission stuff, and then you got HHS, and then there's so many variables, and then you throw in all the state stuff. No wonder you don't know what you're doing. And then I didn't even make a note of what the last thing said, but I just made a note that said, that's a great idea. I have no idea how that could be done, and I kept moving. So I definitely recommend, if you have any interest in this kind of, work and understanding the policy, and if you have ideas, we need them at the table.
Mm-hmm.
But again, here's my concern is we're going to do the same thing, because I believe that we're in this mess because had there been any enforcement that would get people to follow the HIPAA security rule when it was implemented in 2005, if they could have made them follow it, even, put some teeth behind it, then we wouldn't be where we are now.
No. Nope.
I mean, we would have had that foundation. We would have been prepared for when the things changed, but no one made them do it. And you have to make them do it. I don't know about you, but if it says, I can't drive 55, if the speed limit's 55 and I know ain't nobody looking,
mm-hmm.
I'm not going to necessarily drive 55 or whatever it is. It's the same thing. But at least with that, I do have to make an investment in the vehicle to be safe and to drive it. But if there are no guardrails and there is no incentive to invest in it for one reason or another, do you know any business that invests in this kind of stuff? Unless they feel they're concerned about it? Or your favorite, where they're concerned about what is it? They're concerned about phishing, but they're not concerned about social engineering
Yeah.
or email compromise. But we're concerned about phishing because that's one we know.
Yeah. Mm-mm.
No.
Yeah.
So I think these are great suggestions, but I don't know that we're not getting to a point where we have to kind of have a fork in the road for the smaller, under-resourced and the larger entities and how we can get there. But again, we can't get them to do the basics. That's our first problem.
Yeah.
Till we get over that, that's our number one concern, at least in our world.
Yeah. And I mean, I don't know. I don't have a good idea on how to get them there because everything that we've tried, I mean, we've had some successes, but nothing that's a sweeping success.
Well, I mean, we're finally getting them to know that 405D is something to do with cybersecurity at HHS.
Yeah.
We're finally getting them to know that it's not just about HIPAA anymore.
Mm-hmm.
But look how long that's taken.
Yeah. I mean, this year is the 10-year anniversary of the HIPAA Omnibus Final Rule, which brought IT into the picture. And we're still 10 years later, still trying to get IT folks to understand how it applies to them. If it applies to them, how do they fit in?
Well, now, and you're talking about the Omnibus rule that it fully implemented high tech and how it applies to business associates.
Right.
So I just want to be clear.
Yep.
So yeah, I mean, we still have them talking about how it doesn't apply to them in this scenario.
Yeah. And for the few that actually do have some knowledge of it, it's a scary thing to watch some of the threads because they'll get enough right to where, they've been exposed to something, but then they take it and just drive it slap off the tracks. And you're like, okay, you were doing good, but you don't know it well enough. You don't know it as good as you think you do.
Yeah.
So it's a problem.
So I think that's driving us right off the tracks with this episode.
Yep. So without further ado, there's a lot to be done.
Yuck.
All right, folks, that's our show for today. Thanks for listening. Be sure to share us out, rate us, give us a review, all those good things. And remember, for Donna and myself, HIPAA's not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.